You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic is a smile makeover show. How small improvements to your smile can make a big difference. According to my first guest, it can actually change your life. From Hanford, California, he's the Central Valley's cosmetic dentist, Dr. Nagrani. Dr. Nagrani, welcome to the program.
Thanks for having me, Randy.
All right, now before we get into today's topic, I know you brought some photos and you're very proud of the photos.
Yes,
but for people that don't know you, tell us a little bit about your practice. What are the different procedures you do? And who's the typical patient?
Well, I've been in practice for 17 years now, and you know, the really good thing about being a general dentist, I get to see everybody.
All right.
I'm a family dentist. I get to see families. We've got everybody from the whole the population. It spans. We've got electricians, we got plumbers, we got firemen, we got teachers, we've got students, we've got doctors, we've got nurses.
Now, people don't like to go to the dentist, right? I mean, do they tell you that? Do you hear that all the time?
All the time.
What do they say? Like, how do they break it to you?
Oh, I ask them how they're feeling when they're there, and say, I'd rather be somewhere else,
Do they really say that?
Yeah, and people don't mean that in a mean or nasty way at all. It's just a natural human emotion when you're afraid or fearful about a certain situation, and you let it be known. And I prefer the honesty.
Now, you're a dentist. Of course you think, respectfully, that the smile's important. Maybe even the most important thing. I mean, how important is the smile, in your opinion?
Obviously, I think it's very important, but ask anybody else who's in a power position to tell you about what looks good or what not. Let's take magazines for examples.
Right.
We have Muscle and Fitness in our waiting room, our lobby. We've got Elle, we've got Cosmopolitan, and all of them have done their own research surveys. Ask people what they find is attractive, for example.
Okay.
Okay. Let's start with attractiveness, amongst other things. The top 10 quality is what both genders, male and female, would find attractive. And on the top 3, and in Muscle Fitness it was number 1, was a smile for both.
Is that right? Even
for
Muscle
both.
Fitness, you would think physique, but smile.
Right. You would think bigger biceps or firmer whatever. And it was smile every time, if not in the top 3.
Now, in this economy, do you find people investing in their smile?
Absolutely.
Or wanting to take care of their smile?
Absolutely. And you mentioned because of the economy, there's a lot of people in the job market. So they're interviewing, they're looking for jobs. They want to look good. I mean, you take 2 people who are, let's say twins.
Yeah.
One has got broken down teeth and one has got perfect teeth. Chances are the one with the broken teeth is not even smiling at this point, but they're both sitting in the same interview.
That's a good point.
Who's the job going to go to?
Well, you do. I mean, if one's smiling and one isn't,
Yeah.
attractiveness aside, the one smiling seems more positive.
Sure. It's
Okay.
We're humans, and so we make judgments. Psychologists will tell you within the first 5 seconds of meeting somebody that you've never met before, you've made a judgment of some sort. You've made an opinion, and you want to be on the side of a positive opinion right away. Because you only get one chance to make a first opinion.
You say, we've talked, that you're changing people's lives. And I said this at the top of the show. I mean, do you believe that? I mean, do you see that happening?
I see that all the time. I wouldn't have believed it unless I'd seen it myself.
Okay.
And so let me give you some examples. We've had patients, and this one lady stands out, young gal, pretty. She had some stains on her teeth. They were kind of crooked. She was never comfortable with her smile going through high school, and kids can be brutal then. So
all right, yeah.
She was stigmatized with that. And somebody might have mentioned something about her smile not being perfect in school, well, in not so many words, or maybe in more words. And so that stayed with her for a long time. And now she's married, but she's still very conscious about a smile. But she doesn't know what she needs to do about it, or if she can change it, or if she's just going to live with it. So she's kind of depressed about it, and more of an introvert. And then we offer her with options, and then we change her smile ultimately to something that she's just elated. She sees it, she jumps out of the chair, she can't stop looking at herself in the mirror right off the bat. Maybe long enough.
Do they tell you this, by the way?
Oh yeah, I mean, well, they give us a hug and then go back to the mirror again. So that's just rewarding for us, and we know we've done our job when we get that hug, especially. I mean, obviously, I want to be sure I like it first, but the icing on the cake is when the patient starts crying.
Is that
I
right?
love my
So
smile.
when they see their teeth for the first time, sometimes it gets emotional?
Oh yeah, and then you see that patient after, because that patient has gone so long not knowing how to smile, not wanting to smile. So that transformation takes a while. First you have that beaming, self-realization, this is me. I want to go out and improve the other aspects. You see them getting a tan, you can see them doing their hair, nails, and everything else after that. And then the personality follows from there. The person becomes more of an extrovert, more social life. They've marked on their health history form they were single, and now they've got a boyfriend, or they've got other contact info. And we ask, who should we contact in case of emergencies, for example. And before there was nothing, maybe a mother or father, and now there's another person,
and
a male.
You think it's because of their smile? Possibly.
Yeah, could it be a coincidence right after that?
Okay.
And we've seen these patients.
Well, there's no doubt about it. I mean, since we've talked on the phone, you walk around and the people smiling, they're more approachable, no doubt about it.
I got another story about that.
Okay, okay.
Well, this gentleman, he's been in our practice a while, and he was not comfortable with his teeth also. Again, you know, smiling. He's a realtor, so his job is to approach people and make a good impression. Okay. There's a lot of realtors out there, and so he wants to be the one to represent you. But he was never comfortable in those shoes doing that until we fix his teeth. Now, we did not know this going in, you know. A lot of people don't want to talk about this stuff. But it's afterwards, you know, even a few years after that, we asked them, you know, yeah, you're happy with your teeth. Obviously, we saw that. They were really thrilled with what they got, and they couldn't stop talking about it. They send us more patients, their family, of friends. And then so I asked him, well, you know, Joe, tell me exactly, what impact did this make on your life? And he goes, you know, as a realtor, I could never approach people.
Interesting.
I held back from doing this, and now I can. I feel so nice being able to do that, that I can fulfill myself, what I'm doing, my profession. I can take it to the level that I want to before. There's nothing holding me back now. You know, so it makes a very deep psychological impact on a person's nature here.
Now, we've talked, you said that just small things can make a big difference.
Oh, yeah.
And you want to make sure that when you came on the show, and I think I need to mention this, that it's not just about veneers, and it's not just about, but the small things. Elaborate on that, what you mean by that. Small changes to the smile. Now, what are the categories of cosmetic dentistry as you see it?
Okay, let's start with something as non-invasive or simple as bleaching, whitening your teeth.
Okay.
Okay, that's a take-home kit. You do that at your own pace, at your own level. Guaranteed you're going to get a change. No doubt about it, it works.
All right.
Okay, that one thing is going to make such a big difference. You know, because the darker the teeth, the older the appearance. So that ages, that brings you age right there, just simple. No drills, no shots, no nothing. I mean, it's just the easiest way to do that.
So there's an art to this, as you see it.
And science.
I say, okay.
Okay, definitely an art. I'd say it's about 50%. You know, the science you learn in school, the art you can learn, but it takes an eye to visualize
because
that.
I feel like I could spot veneers walking down the street.
Not mine.
Okay, okay.
I know it sounds cocky
So
to say that.
but that's in the hands of the dentist, you're saying?
Yes, absolutely. Between the dentist and the lab, you got good communication.
So you're saying golden proportions?
Yes. It is.
Is that a Da Vinci thing or something like that?
He got into that. The Vitruvian Man, the sketch, the pencil sketch about the man with his arm stretched and the circle around that, which he borrowed from a Roman architect called Vitruvius. And this is what's called the Vitruvian Man sketch. So he put in proportions of all kinds that exist in nature.
What does this have to do with teeth, though?
It exists with teeth, too, because proportions are what the eye beholds as beautiful.
Interesting, okay.
That's what it comes down to. Harmony amongst many things in a whole. Between the teeth.
Right.
You're looking at one tooth to the next. There's got to be harmony between those teeth. And there's a set, I wouldn't say a definition, but there's a set quantification of those ratios from one to another that makes it look good, that we perceive as good. It exists in nature. You see trees have it, plants, flowers. Solar system, the Milky Way, the spirals, they're all in the same proportion.
So when you create a smile, you feel like you're creating a smile.
Absolutely.
It's not just veneers or this or that.
I want to use the term engineering the smile.
Okay.
Okay, because we use a lot of math. We use those proportions. We take pictures, and then we measure on those pictures the specific landmarks we're looking for. Eyes, nose, chin, lips. That gives us a starting point and where to go with the length of the teeth that we want to change, the width of the teeth from there, and the width of the other teeth from there. One thing begets another. And so we use that as blueprints. Let's call it blueprints.
Okay, I interrupted you earlier. I said the different types of cosmetic dentistry.
Yes.
Okay, so we talk about whitening. What else?
The next step up from there would be minor tooth contouring. You know, that way we just take a little bit off here, we round this up, we sharpen this up, maybe add a little bit of bonding here. So we don't really change the color if they're happy with the color, or we can do the bleaching first and then do the contouring and take a little bit of here. Very conservative. And that makes a whole difference because, again, it brings the teeth into proportions as much as possible within that framework. Okay?
What about metal?
No metal. We don't use metal, any kinds, for anything.
Okay, okay. But do you remove? Are you equipped to remove metal fillings?
Yes, I am. I don't do it for the sake of removing metal unless the patient requests that.
Okay.
But I do a lot of that.
All right.
It's out. It's not on its way out. It's out.
That means using metal now.
I'm using metal.
Amalgam fillings.
I'd say the only thing is if you have a partial denture, you maybe you use metal. Even there, there's options. There's alternatives to that. So we don't.
Okay.
I want teeth to look like teeth. Teeth don't have metal. Okay. I got into this to make teeth look like teeth.
And so who is the, because we're talking about smile makeovers, cosmetic dentistry, and so I guess it's all types of people now are coming in to improve their smile.
Oh yeah, absolutely.
It's not just a certain high-end demographic.
Oh, no, not at all.
Just regular people.
Everyday people, conscious about their smile. And people who aren't conscious about their smile, they know something is up. Maybe the whole nature is kind of diffused a little. We make a suggestion. We ask them. We give them. It's all about education. Okay, we don't push anything. This is what's available. I just want you to know, importantly, this is what you have available to you in a very easy, fast, instant way of changing a lot about yourself for the better. If you don't know it's available.
So going to get a consult.
Exactly.
And you're one of the guys that does a free consult.
We don't charge.
I wasn't really even aware that they were charging for consults. Nicole, who does all of our media buying, works with the Wellness Hour. She called one place and they had a $250 consult. Turns out that I guess that's very common. And I said, you got to be kidding me. And so you don't charge a consult. That's good.
No, we don't. We'll take all the time we can.
What takes place on that day?
A lot of chit chat. We want to talk. We want to get to know our patients. We want to see what their motivations are, what they don't like about their smile, if anything that they have seen. Okay, we take pictures because that's an easy way to look at it, blow it up on a screen and pick out what is up, make some measurements, what they don't like, maybe what we can change, present it to the patient as such. Look, these are the issues we're seeing very objectively. There's a lot of subjective that goes into a smile. You like it, but you don't know why. Well, we have some objective criteria that we put into there to make it a good subjective smile.
All right.
And so we plug those numbers in and we get a feel for where it should go. In fact, for the most part now, looking at somebody, I know where it should go.
So you can spot it and see the end result.
Oh, yeah. I mean, you do enough of this, you know where it's going.
All right. Now, you brought photos. What are we looking at here?
Okay. This gentleman, very interesting.
Okay.
This is the before. You can see a bunch of different issues. He has been part of our practice for a while. I was always nervous going into the room to meet him for an exam because he wouldn't smile. He was really gruff. He's a big guy. He just look. Good morning, and that's why he wouldn't talk much. And you ask a question and you're trying to get a dialogue going and you get one-word answers. Here's the thing: he's not like that anymore.
Okay,
it's a big change. I love seeing him. He's one of my biggest.
So when you look at
advocates.
that smile, what does he say to you? What doesn't he like? He just doesn't like the whole thing, or what does he say?
Yeah, he doesn't like the way his teeth look. They're worn down. They're short. They're dark. They've got cracks in them. And he's just not happy with a smile.
So what do you see? When you look at that from a dental standpoint, artistic standpoint?
Proportions are off. Look how flat these front teeth are. It's reverse. They usually should follow the line of the lower lip.
Okay.
Okay, look how opposite it is. It's all worn down. Another thing, it's an aged smile. It's an old smile. It looks like he's a lot older than he is.
Okay.
He doesn't know this, but that's what he doesn't like about it. Okay, the color is darker. It's worn down as you age. But his smile is aged far beyond his actual age.
So he knows he doesn't like it. He doesn't really know why, but you know why.
That's absolutely. You see this long enough and you know what it is and what you can fix. Okay, so we talk to him, we counsel him about what we'd like to do with each one of those specific problems. Get into one harmonious smile, proportions again. So once we decide this is where we're going to go and he's agreeable to treatment, when we start treatment, the first thing we do is put the patient in temporary veneers or crowns or what it is that we're going to do. Okay, what that is simply is we've taken the blueprint of all those measurements I've talked about.
So you give them a temporary set of teeth?
Yes.
Do they look at them and they say, I love this?
All the time.
Okay, all right.
I want to say, never say never, but there hasn't been a time.
Love their...
Yeah, there hasn't been a time when they have not liked.
So they have the temporary teeth, they go home, they show their friends, their family.
It's a huge improvement. Oh, yeah.
All right.
Now here's the things we contend with. Okay, we assume we're going to take it to this level of color, for example. It's something that you may not be used to. Maybe in your head you wanted lighter. Maybe you don't want it as light. We can change that in the temporaries. That's one way of knowing for sure.
Okay.
You don't get the final product and decide, oh, I want to change this. You've got ways of changing it before you get the final product. And so that's one of the things. Nothing is the shape of the teeth. Maybe one side is rounded, like I talked about. It should be sharper. It should be more rounded. The proportions of the teeth to each other. Is that harmonious? Does that flow well? When the patient smiles, do you see the harmony in the smile? Does it follow those guidelines? And sure, that's the best time to know. And 3 weeks later, we see the patient back and say, well, what do you feel? What do you think?
They say they love it.
Love it. What do your parents think? Oh, your family. What do your friends think? Coworkers think? Everyone loves it. Yeah, it's really nice. And so we take another mold of that, send it to the lab and tell them, duplicate this exactly. The day we put the final veneers on, you see the big change, big transformation. This is what it looks like. Okay?
Very nice.
Now, look at the big change. Those short front teeth, reverse smile. Look at how it's following the lower lip.
Yeah, it's a big difference.
We changed the color. He looks younger.
Yeah.
Look at his smile here. I had to force him to smile before, just so I could see the teeth.
Well, you said he was intimidating before, because now he looks like
Oh, he's a big teddy bear.
somewhat of a nice guy. Yeah.
Oh, yeah, he is. He's a great guy. I don't even have to ask him
So he walks in the office differently now that...
Oh, yeah, absolutely.
Okay.
He talks about his life. He chit-chats with my hygienist. I mean, they used to be scared. You know, oh my God. You know, see, they look forward to seeing him, but they didn't look forward to cleaning his teeth. Now they do everything because they enjoy it. They visit. They talk. You know, he's opened up so much more.
People prejudge when they don't smile. I guess that's
Absolutely.
the point here.
Yeah.
You think they're angry,
Yeah, absolutely.
mad, or
What would
stuck
you
up,
think?
or depressed, or whatever. I
Oh,
guess so,
he's-
yeah.
It's a big guy, burly guy like that, not smiling at you. You're going to walk across the street. You're going to change over to the other side of the road if you're walking.
But he's a lot of people.
He is a representation of almost everybody.
Is it more men or more women that come in for this?
It's a close proportion, but women a hair more.
Okay.
Say 60-40. There's a lot of men in it. Looks have become such an important part of our life now, more and more, whether we like it or not. It's everywhere. It's on the news. It's in every magazine. Look at your looks. They want you to focus in on your looks, so everyone is. And they're looking at that. So one of the first things they do is want to lighten their teeth. From there on, they realize that, okay, this needs to be done or that. And so we've got different ways of addressing that. Depends on the severity of the problem.
And that looks very natural. I mean, those look like his teeth. If I were to seen that, you know, because I told you,
Right.
I could spot veneers across the room, and that just looks like a nice smile.
That's one of the greatest compliments, other than the hug, is when someone can peg exactly, you got veneers. They don't know what it is, but you got a nice smile.
Is it one of those things where they say, I should have done this years ago?
Absolutely. You know, this with ladies, everybody wants to look younger. And after seeing the final result, you say, oh my God, I look 10 years younger. I should have done this a long time ago.
Do you spot it, by the way? Because, you know, you see some people, they've got the bag and the shoes and the great skin, and maybe they have an older smile. Do you spot that? And what
Absolutely.
is it that's keeping them from doing something? Just afraid of the dentist? What is it?
It could be afraid of the dentist, but I think the biggest part of that is not knowing what's available to them, what their options are to do something about their smile, because they're pursuing all the other options that are out there. They're doing the nails, they're doing the skin, they're doing the Botox, they're doing the hair, because it's out there. But as far as the teeth goes, who's talking about that? We want to talk about that. We want this information out there. We want them to come in and ask us. Like I said, you know, we'll spend all the time we can addressing your needs, and it's specific for everyone. It's not a cookie cutter smile. We don't do that. Like I said, we take in proportions of you, your nose, your chin, your lips, and make those teeth to fit you. It's not the same for everybody. So there's no cookie cutter smile.
Okay, so you have more photos.
Yeah. Let me show you this other young gal. Really pretty, conscious about a smile again. And this one is very obvious. So here's a young gal that comes in, and she's got these two yellow teeth. She doesn't like, obviously. You know, she doesn't know what it is specifically, what we're looking at, but when she comes in, she says, those teeth are the wrong color and they are the wrong size. They're too small for my face. Now, these are two veneers done by her last dentist.
Okay.
Now, maybe you could have used
How
a
did they
different
turn
material.
color like that? Because I hear that veneers, they say they don't really stain.
It's not the veneer themselves. I think it's the cement that was used underneath the veneers, because the veneers themselves are translucent a lot of times.
Okay.
So that could be a show through or
Something like that.
yeah, maybe she decided to use some bleaching toothpaste or something to lighten the teeth.
So she just wanted that fixed. What do
Yeah,
you see when
exactly.
you look at her? What do you
Now,
see?
here's the thing that she's not seeing is look at the gums. They're just all over the place. They're low in one place, they're high in another place. They're not in harmony. They're not in those proportions we
So
talk
the gums
about.
are uneven.
They're uneven.
So you want to make them
Exactly.
even. Okay.
So that's one of the things we did. Here's the final one. Look at the improvement now from here. The little things that we did, the small improvements, what a big change in her smile and her personality. You know, Randy, I love cooking. When I look at a recipe, you can go through a whole bunch of different ingredients in there, and the end result is something that tastes good. Or you could go with just a few simple ingredients, and it's a fantastic result. So I'm looking at that relationship, the ratio, right? Little effort to a maximum result, and that's what we got right here.
And so what do you do for the gums, by the way?
I have a laser.
how did you even...
I have a soft tissue laser, which does just that. It's meant for soft tissues, gums. You know, there's no cutting, bleeding. It's very simple. I do it at the same time I'm working on the veneers. And so it's a done deal.
Now, what if people are missing teeth? Because I know you do dental implants too.
Yes, we put in implants. We treatment the case with implants, and we do everything about the same time. So we get a good harmonious result for everything that we're doing at one time. We get all those teeth placed at the same time. The same lab guy is doing them, so there's no change. It's like paint. You know, you can get the same paint, but after years, if you put it on, you'll see the difference. We don't want to do that. We want to do everything at the same time, as many as we can, that we visually see the teeth. Here's another one I want to show you. Even less that we did that made a big difference in her smile. Take a look. Pretty obvious. She's got those stains on her teeth.
What is that?
Fluorosis.
Okay.
She's not happy with her teeth, obviously. She's 28 here. She's had this all her life. Can you imagine her life in high school?
Right? And that's just always bothered her.
Oh, absolutely.
Did she hide her smile because of it, or cover her smile because of it?
She would speak like this, with
Did
her hand in front.
Did you pick up on that when?
Every time when I see overgrowth of facial hair in a man that correlates with bad teeth, you know why that hair is
the
there.
walrus mustache.
Exactly.
They're hiding teeth under there.
Exactly. They're hiding that. You know, and then hands in front of the teeth, or a very tight upper lip when they're talking. Like
they've learned to talk and cover it.
Oh yeah, there's tension in the muscle because they're making a conscious effort not to smile or not show their teeth while they're talking. Okay, that's a red signal right there. There's something needs to be done.
So this gal comes in.
Yeah.
And now this is an easy one for you, probably.
Oh yeah, this is not a veneer case. You know, we did a little contouring of the enamel, like I talked about, taking a little bit off here, a little bit there, doing some bonding to cover up. So we didn't change the color of her teeth, just the overall shape. A little bit on the gums. You see how the gums right here have dipped down. They're uneven. So we took care of that. Compare these two. This one's up here, this one's lower.
Okay, so you had to even out those gums.
Yeah, so we did that, like I said, at the same time that I'm working on the teeth. It doesn't take any more time because I'm using a laser here. Look at the final result over here. Look at a big change on her smile.
Very nice.
Look how much more she's smiling. Exactly.
So, I mean, this is somebody that says, boy, I should have done this years ago.
Yeah, and look even less than all that we've talked about before. It's just minor bonding spot, you know, here and there, taking a bit off here, adding a little bit over here. Big, huge difference. It's kind of like we look at the gums too. You want to see a great painting by one of the masters, and then you have this crummy frame around it. You know, the gums are the frame. You want to make sure the frames look good as well.
I mean, you're into this.
I love it.
I underestimated you.
Yeah.
You know, when I knew you were coming here to talk about, you know, cosmetic dentistry, and I'm thinking, oh boy, this is going to be possibly, you know, not the most exciting interview. But I think anybody listening to this can pick up on your passion, on your excitement, and you like this, and you do see people transformed. And it's more, and I think you've presented a great case, and it is more than just teeth.
Oh yeah, I feel this way about it. My staff do. They do. They can see a case coming too. When I'm talking, you know, they won't say anything, but they know where it's going, and we talk afterwards, and they can pick it out exactly. Because
you get excited sometimes where you say, boy, this is going to be good.
Absolutely. You know, when we can picture the end result right there, and you can see where it's going, and I just can't wait. I even tell my patients, I can't wait for you to see the final result, because I know how happy you're going to be.
Is it hard for them to take sometimes? You know, you're smiling, you're excited.
You know, the only...
Where they say, hey, you say this to everybody?
No, not at all.
Okay.
I think they can see the sincerity there.
Okay.
We've done this long enough to where we're catering to each individual as a person. This is good for you. This is what the issue is. This is what the fix is for you.
What do you want people to know about you, by the way, in your town? You know, at the top of the show, we said, you know, this is the Central Valley's cosmetic dentist. What do you want them to know about you? Perfectionist?
Yes. My wife doesn't like that, but being a perfectionist means being a little bit of a pain in the
I guess you want that in your cosmetic dentist,
yes.
but you don't want that, I guess, as a spouse or whatever.
I get my fill of being that pain in the, you know what, by being a perfectionist at work. So at home, I don't have to be that way.
But you said sometimes you go home and you're still talking about it. You're excited about it.
Yeah, sometimes I'm talking about it.
And she has to say, hey, please, you know, every once in a while.
Yeah.
Enough about dentistry stories.
Exactly. So I talk about it, especially when you finish with the case. That's when she knows that I'm home and all bubbly, jumpy, talking about it the whole time. And we do have to give a chance for the kids at dinner table to talk about their day. So I learn to shut up sometimes, you know.
Okay.
And she reminds me. She's really good about that. Do I have time for one more photo?
Yeah. Okay. One more.
I love this patient to death. She's been an incredible person. She knew what she didn't like about her smile. We knew what she wouldn't like about her smile. Look at the teeth. They're spaced apart. They're different proportions. Colors. Each tooth is almost a different color. She had a crown done over here. That was off. Look at the back teeth. You know, the gums. It's almost everything. Look at how much she's smiling over here. The lower lip is pulled down by her front teeth. Mm-hmm. She almost doesn't want to show everything. And this is me asking her to give me her biggest smile because I want to take a picture. I want to see those teeth. And this is as big as it got.
All right.
Okay, now look at the after picture. Look at how big she's smiling over here.
It's very nice.
Yeah.
It is very nice.
She's a huggy lady. All the hugs came there.
So it's just veneers for her.
This we did veneers. We took care of her gums. We took care of the proportions in the teeth. And we took care of the color.
That's a younger looking smile.
That is a younger looking smile, and that's exactly what she said. You know, she didn't know what it was about a smile, but after we got these on, she could tell the age difference, which is important to her.
Do you find that people start taking better care of their teeth? I mean, once you do this?
Oh yeah, they're more aware, they're more conscientious about their teeth and how to take care of them. They're more involved with their teeth. Before, you know, it's human nature. If there's something you don't like about yourself, over time you ignore it. Your brain just stops seeing it. You know?
Wow.
And so but by the time
this is heavy stuff.
Yeah, this is psychology, right?
Okay,
so by the time you come to the dentist, you almost don't know what to ask for a lot of times. But the dentist knows, so just go in, you know? Because you've blocked it off for so long, you're not seeing it. Your dentist knows.
Very good, very good. Okay, so go to Dr. Nagrani. Small things from whitening, contouring, getting rid of some of the metal out of their mouth if that's what they want.
Sure.
Veneers, dental implants. Is there anything we haven't mentioned that you do? You take care of gum disease?
Yes, we do, also? Absolutely. Very objective criteria. We monitor, come back in 6 weeks. We see if there's any improvements. If not, we get a little more aggressive. So it's very objective how we take care of that.
It's full family dentistry. I mean, you do teens and those kind of things.
We do orthodontics too. Because a lot of times
What were you going to tell me about this?
Well, we're getting to the different procedures.
I had your life story here.
Yeah, I got veered off when you asked me about the procedures I do. That's one of the things we do, orthodontics, because a lot of times veneers are not going to take over a problem teeth that are in different positions. It can only do so much. So we want to get those teeth in the right position. You know, your tires, your wheels, they want to be aligned. You know, one tire in a different position, you're going to put a new tire over it. You're going to bring it back first, right? And then put a new tire. Same thing. That's what we do.
All right. I want to thank you for coming on the show. Great stuff. Great stuff.
You.
And we're having you back to talk about dental implants as well.
Okay.
So again, great photos, and we'll have you back. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. For you people that are on Twitter and you want to say something nice about Dr. Nagrani, just put hashtag The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.